The Blood Service has made sweeping changes to the way it screens potential donors for the risk of HIV, bringing us in line with a number of overseas countries. Effective immediately, men who have sex with men can now give blood after abstaining from oral or anal sex for 3 months, rather than the previous 12-month stand-down. Anyone taking HIV prevention medication can't give blood until they've been off the drugs for 3 months. People who've previously lived in a country with high HIV levels can now give blood after 3 months instead of 12, and that stand-down period for sex workers or anyone who has accepted payment for sex has also been reduced to 3 months. Joining me now to discuss the changes is Dr. Peter Flanagan from the New Zealand Blood Service. Kia ora, Doctor. Why have these changes come about now?
Well, 6 years ago, when we introduced the 12-month deferral, we also committed to monitor the environment and to make further changes as and when sufficient evidence came to light to demonstrate that it would be safe to do so. 2 years ago, the United Kingdom introduced a 3-month deferral for the set of criteria that you've outlined, and we now have sufficient data from their experience linked in with information from other countries to be confident that we can safely make the change whilst ensuring that New Zealand's blood supply maintains its high reputation for safety.
So men who have sex with men, they have to abstain or have not had oral or anal sex for 3 months in order to give blood, even if they use a condom. Why is that?
Well, we know that in the very early stages of infection that our tests, though the best available, may not detect the virus, and therefore there is a small risk that HIV could be transmitted to the recipient of a transfusion. Our primary responsibility is to assure safety. Now, the issue with condoms is condoms are highly effective at reducing sexual transmission, but they're not 100% perfect. And because there is a small risk associated with condom failure, New Zealand Blood Service, in line with most other international blood services, does not accept that condom use per se is sufficient to remove the requirement for the deferral period.
So is that a decision entirely based on science, or is there a degree of prejudice in that?
Well, I believe it's based on science.
So also on international evidence, is how much of an increased risk is there with these shortened stand-down periods, if any?
Well, we believe that the data that has accrued over the last few years demonstrates that as we've progressively reduced the deferral period, and remember in 2008 it was 10 years, so over the 12-year period it's gone from 10 years to 3 months. And the evidence indicates that that change has not impacted adversely on the overall safety of the blood supply, and that gives us confidence that continuing to reduce the period of deferral will assure the level of safety, whilst hopefully allowing greater levels of participation from groups who are affected by the criteria.
So countries that have high risk of HIV, people coming from those countries, regardless of their sexual status, they, stand down for 3 months before they're able to give blood as well?
Indeed, we've always identified that our aim is to look at the pattern of HIV infection in New Zealand and to put measures in place that will ensure that all risk categories are appropriately affected.
So which countries, sorry to interrupt, Doctor, but which countries remain on that high-risk list then?
Well, we use the same list that the Department of Immigration used to define high-risk status for HIV. Essentially, it's predominantly sub-Saharan Africa, but there are also some countries in Asia which will fall under the list. A full list is available on our website.
Okay. And if we can look at the potential donors who are paid for sex, so potentially sex workers and others, they have a stand-down period of 3 months before they can give blood. Now, that's down from a previous 12 months.
Yes.
What is the risk there with being paid for sex and potential HIV risk?
Well, these criteria address not only risks associated with HIV, but also with a range of other viruses, particularly hepatitis B and hepatitis C. And what we know is that in some countries around the world, sex workers are at increased risk of carrying the range of bloodborne viruses of concern, and therefore we have the 3-month period in place for deferral.
But is that the same in New Zealand? Are sex workers at higher risks, or is there any evidence that they have higher rates of these infections?
This was looked at in some of the independent expert reviews some years ago, and we began to reduce the deferral periods at that point. At this stage, yes, there is an increased risk, although that risk is not necessarily great. We do, however, need to bear in mind that the criteria apply not only to sex workers in New Zealand, but people who've had sex with sex workers overseas and people who've worked as sex workers overseas. And most certainly internationally, there is a high correlation with increased HIV risk in those settings.
How old is the data in relation to sex workers?
Sex workers in New Zealand or from overseas?
In New Zealand that you're relying on in terms of infection rates.
The data that we're relying on is the data that's produced on an annual basis by the AIDS Epidemiology Unit at the University of Otago. And they've been party to the discussions we've had around making the changes. So, I emphasise again, the risk of HIV with sex work in New Zealand is low, but there are other risks. And we need to remember that when we talk about sex workers, that parts of the industry are very well regulated, but there are other parts where people have accepted sex when there is a risk of prior injecting drug use and similar behaviours.
So are you relying entirely on trust in terms of these conditions?
We always rely on trust, and I'm pleased to say that I believe that those people who donate blood in New Zealand are generally very honest in terms of the information they provide to us when we screen them for suitability. Having said that, we use the combination of testing and donor criteria, and together they've been demonstrated to be far superior than relying on one or other modality alone.
Appreciate your time this evening. That is Dr. Peter Flanagan from the New Zealand Blood Service there, discussing changes that have been made to screening of potential donors for monitoring viruses and HIV with people giving blood.